And now, from sunny California, this is Doctor to Doctor. With me today is Dr. James Privatera, and we're going to be talking about what's in your blood. So stay tuned. Dr. Helen Pensanti, and welcome to Doctor. With me today is Dr. James Privatera.
Glad to be back, Helen.
Thank you for coming. I wanted to do another show on blood because he's written a book called Silent Clots, which we did another show previous to this, but it was so new and so interesting, I wanted him to come back and talk about our bloodstream.
Well,
now,
it's obvious why it's so popular. Leviticus tells us the life is in the blood.
Right.
All throughout the Bible, they talk about the blood of Christ, the blood of the lamb on the mantle.
Lintel of the doors.
Yes,
yeah.
To prevent the firstborn from being killed.
Yeah.
All the references to blood. Well, it also stands to reason that nutrition is intimately tied up with blood examination.
Yeah.
So in the blood, the worst thing we can see, I believe, is excess clotting.
Now, how did you first come upon this? So give me a little background of how you didn't just wake up one day and know this. I mean, were you praying and God told you, or how did, give me...
Well, that's an interesting thing, because having been doing this test since 1977, we saw people who had headaches, who had clots. We would treat them with nutritional materials, by the way, also biblical treatments, fish oils.
For headaches?
Yes, for headaches. Wonderful.
Thank you.
Wonderful.
Thank you.
And it's on page 10 of my book, all the various natural remedies that are effective for treating excess clots.
I'm glad you said that. You know, I've never had a headache in my life. I'm one of these people, I don't know what it is, I just never get headaches. But I'm very sympathetic to people who do.
And it tends to be more women that have headaches.
Yeah, they have those migraines.
Yes, and they're very bad. And
so fish oils.
This has been written, by the way, in Annals of Allergy 1981. They used heparin, but heparin is a very powerful natural anti-clotting material. You don't need, we use it once in a while in the office. It's very effective under the tongue. So sublingually, even though it's used for injective purposes, as you know, it's a blood thinner.
So wait a minute, you're saying someone who has migraine headaches can come into your office and you'll put heparin under their tongue and their migraine will go away?
Goes away within 5 minutes out of 99 out of 100 times.
So no more going to emergency rooms and getting big shots?
They don't need those shots that promote heart attacks, right? The imipramine or whatever.
Well, I'm just talking about any kind of painkiller.
Right. They don't. The fish oils work very effectively within about 15 minutes.
Oh, that's wonderful.
So they don't need to use the remedies that we use necessarily in the office. They can use fish oils. They can use lots of magnesium. They could use a lot of garlic if they like that. They can use feverfew. And feverfew is, as you probably will look in our herb book, you'll see feverfew, migraine.
Right.
Well, it's been studied in Utah to do what? To break up platelet aggregations, which are clots.
The clot.
So there are many things that cause excess clotting, many conditions. Headaches, chest pain, angina is caused by excess clotting. And, of course, one of the cases that's very dramatic, and so this doctor allowed us to put his story in the book and his name on the back, is Dr. Bob Barton. He doesn't mind mentioning he's a Kaiser emergency room doctor, and they told him he had costochondritis, which is inflammation of the ribs that goes in the sternum. And so he came in, we looked at his blood, he had this big clot. He had all the tests for heart done. He had echoes and EKGs and stress tests, and they said, sorry, you're fine, all you have is costochondritis, which is, of course, an arthritic diagnosis. So he came in, we looked at his blood, he had a big clot, we gave him some heparin and fish oils. In 15 minutes, his clot was gone, and his headache, and his chest pain was gone, his chest pain was gone. So now he's a believer, and just recently, I don't know what I did with the paper, I mislaid it here, but here it is, Cleveland Clinic I'm just going to read this.
Yeah, go ahead.
Small clots found to play major role. And they say largely ignored by cardiologists because they cannot even see them. This came out in January the 10th.
So Cleveland Clinic is
now
the big famous clinic back in Ohio, is it?
Right, Cleveland,
and then
Ohio.
they have another one.
Big heart clinic.
Heart clinic somewhere else. They have a satellite one somewhere down in Florida.
So they're basically confirming what we've been finding since 1977, that excess clots can be seen, and actually it's about 1,000-time magnification. Let's see the slide,
right.
Dan. That's normal, where every cell is different and distinct, and really shouldn't be. It has the capacity.
Looking little circles.
Should be round. The red cells should be round.
And they're 8 millimeters.
About 7 to 8.
7 to 8. Okay. And then you want to see another slide now?
Next slide.
Abnormal, Mr. Director. There.
Okay. So this is a little throbbing clot here. See, at least it looks that way to us. It's not really throbbing. It's I'm being facetious. But anyway, you can see the size of a red cell up in the left corner there.
Right.
Left upper corner.
It's taken over.
And it's about maybe 15 times the size of that, the greatest diameter. The diameter is about 15 centimeters. So these clots cause heart attacks and strokes. You can think in 80% of the time they're very silent, meaning somebody's driving along, a man's driving his car, his wife is looking the other way, all of a sudden the car veers into the curb.
Yeah.
She looks over and he's slumped over the wheel.
Yeah.
Well, what happened is he had a heart attack or a stroke. He made no sound. See, and that's the problem. And most of the time people don't make a sound. We're used to people having chest pain or hearing about, but they don't. Most of the time they don't. Somebody wakes up in the morning and they find that their partner, their husband, wife, or spouse, whatever, has passed away in the night quietly. And this is what happens 80% of the time. So we call this condition silent clots or silent ischemia, I-S-C-H-E-M-I-A.
But how could fish oil dissolve that? Is it like you're dissolving grease or something? I mean, how do...
Many things have been studied.
Yeah.
Fish oils break up clots. This is that whole discussion of the prostaglandin system, reducing inflammation.
Oh.
And more has been recently. There's if somebody can get a hold of the February Atlantic Monthly, they discuss chlamydia pneumoniae, and this is found in 50% of the tissues of coronary artery disease and only 17% of controls. So this puts a new dimension on this whole since we last talked. You should additionally be taking things that kill parasites like olive leaf extract. Well, again, the garlic, when I use fish oils, I use a combination fish oil garlic.
Well, wait a minute. Does the olive leaf extract break up the clots, too?
Well, you have a potent antioxidant called oleorupin. So
and it's doing it.
So antioxidants such as the proanthocyanidins in grapeseed extracts, very powerful. In fact, that antioxidant, as you know, is 40 times more potent than vitamin E, which is also a nice antioxidant. It has been studied to thin blood. So antioxidants thin the blood. And then we have another slide. Recently, of course, there's been a lot of talk. This is about antioxidants. Antioxidants cause the a deformity in the red cell membrane. For example,
antioxidants cause it
they cure it.
Oh, okay.
So oxidant damage to red cell membranes, 50% of the red cell membrane, Helen, is called lipoprotein. So oxygen, without the presence of antioxidants, will attack the double bonds in the lipoprotein, forming peroxides, and therefore cause a situation of stiffness, just like your lawn furniture. The lawn furniture, oxygen and heat hits the lawn furniture, the plastic in the lawn furniture, and it gets stiff and brittle and breaks. Right. The same phenomenon also occurs in butter.
And let's tell them why that's bad, because then the red blood cells can't start going into those little capillaries.
Their job, they have to be able to be very soft and malleable and deform, because the capillary is smaller than the 7 microns that they are. So they have to deform and go into the capillary and to release oxygen, which is their purpose.
At the level.
At the tissue level.
And that's why people who have diabetes when they get injured, they start losing the tips of their fingers or their toes, because those by the time the little blood cell, which we just showed you, is going down that little tiny capillary, it can't, squish down There's a TV show that my children watch where this girl goes into a flat pancake and goes all around the floor, and that's basically what they do. They take other food.
What happens to these cells, exactly, without antioxidants, these cells get stiff and deformed, and we know what they're called by medical parlance is poikilocytes, or poikilocytosis would be when you had many. So this is the problem. They're stiff and hard, and they're no longer useful to us. So the amount of poikilocytosis, or the amount of deformed red cells, means the less oxygen you're going to have. Now, smart people like De La Hoya, the boxer, he trains up in Big Bear because then he gets a lot more red cells.
Right.
So then he comes down from 5,000 feet, let's say, or 8,000, down to sea level, and then fights other people.
Right.
And he usually wins.
Well, that's why all the Mexicans win those long races, because they, especially like where I went to medical school in Guadalajara, Mexico, it's a plateau high up in the mountains. I mean, you could barely stay awake. You really, but you come back to normal civilization, and boy, you're ready to go.
Exactly. Of course, the Denver Broncos, another case. They train. Of course, they live in Denver, and that's 5,000 feet up, and they usually win.
Yeah.
Very interesting. So, the oxygen. That's where oxygen creatures show. Another slide. We want to talk about folic acid. Here we see 5 lobes in what's called a neutrophil. The neutrophil is a white cell, and it's also, there's 2 problems here. It's too large, plus it has too many lobes. So what it means is incipient folic acid deficiency. Now, folic acid, as you know, are found in greens. And what's the problem with Americans? They're not eating enough greens. And folic acid has been shown to take homocysteine, a protein that was found, an amino acid really, that causes irritation to the inside, the lumen, or the surface, so therefore allowing clotting to occur. So it irritates the inside membrane of an artery, and then you get a clot forming. And the problem with clots are, in a chronic basis, clots are the first step to arteriosclerosis. So a clot then goes to an atheroma, which is a soft plaque. It has no calcium in it, and then that atheroma goes to a hardened plaque. So people who are 40 and over, if they suspect they have heart disease, can get a test. We mentioned it before, the fast CAT scan.
I'm going to do it.
Coronary artery scan.
One.
Yes, they've asked me. I should do it myself because I'm 58, and to see how much calcification in the coronaries.
Yeah.
So you can do this test. It's about $400. It's all over the world.
Yeah.
So it's available everywhere, and it will tell you how much plaque or how long you've been having clots go to form plaque.
And the good news is people can do natural things to break those up. That's what I love. I love the fact that nobody has to go to their doctor, get a prescription, poison their liver, poison their body, go blind. You know, God only knows what else happens with that medicine.
You can thin your blood, which was and I want to emphasize it's a balance. We don't want people getting too thin blood. You can thin your blood too much, and you can thicken it too much. Most Americans have too thick blood, and we wanted to talk about the biblical relationships, remember? The stress. So stress is probably the biggest cause of excess clotting. Stress increases adrenaline, makes platelets stick together, causing clots. The biblical admonitions about that would be from Philippians: be anxious for nothing, otherwise you're going to cause clots. It doesn't say that in there. It just says be anxious for nothing. And then, of course, in Luke 21:26, it says men's hearts will fail them for fear because
they've reached their cortisol levels go up. They make the clot.
Right.
Goes into a heart attack.
Now, of course, these are the non-believers. Later on in Luke, it says, but be frightened about nothing. If you're a Christian, be not frightened. All these things have to pass before I come. That's where I'm quoting Jesus Christ here. So all these things have to pass. So the Christian is supposed to be calmer, and because he has his faith, he is not going to have that high level of stress. Therefore, he's not going to get clots. His heart will not fail him. So the non-believers, by the way, we all know, of course, disease in general is less in the believers. Believers have less disease.
Oh, yes, absolutely. And they live longer. And when they have surgeries, they come out of the surgeries better than non-believers. And they publish that at Harvard, you know, in big-name schools. This wasn't some, little biblical college that publishes. This is
right. This
our,
is well known
yes.
that keeping calm, and we know just because of all the tranquilizers that have been prescribed, how big a factor stress and stress-related disease is. So we want to stay calm, and we want to stay collected, because if we don't, we're probably going to get a degenerative disease. So all the degenerative disease seem to have excess clotting that we discovered. The arthritics have excess clotting, and of course the fish oils and the other associated, like the GLA or primrose oil, the anti-inflammatory prostaglandin system helps them too. The colitis patient has excess clotting. All these, the multiple sclerotic patient, all these people with degenerative diseases have excess clotting. So they should definitely reduce their stress. We know stress helps people with ulcers. So it's a definite thing. I want to show another slide. This is somebody just with excess fat, and of course we don't know what kind of fat, but we can evaluate then and get a cholesterol, triglyceride, or see how their liver does. For example, if they haven't eaten in 2 meals and they have a lot of fat in their blood, show the next slide, Dan, then we know that their livers are not working as good as they should in processing the fat. This patient had a 5,000 triglyceride, a 600 cholesterol, and a 1,200 sugar, so a diet...
He was still walking and
right.
talking.
And a lot of...
amazing.
And so definitely the dark field, it's an excellent test. Our mission is to see that doctors throughout the world do this in their offices, because it's really a very inexpensive... It's a simple test. It's an inexpensive test. We may do it on some of your...
We're going to. I was going to tell the people, I may as well go ahead and tell them now. Be sure that, especially for those of you who live in the Southern California area, I'm going to invite Dr. Privatera to come to one of our health seminars at TBN, and he's going to bring his microscope, and everybody's going to, who wants to, can have their finger pricked, and he will show you what your blood looks like with those slides. So you'll want to watch when they scroll across the bottom of the screen and they tell you that he's going to be at the seminars. You'll want to come out if you'd like to have a free screening for the people in Southern California. That's our blessing to our local partners. And but anyway, so let's get back to reviewing. I know everybody's saying, okay, I'm ready to do whatever you say, Doc. You know, I'm convinced. So let's just review the simple things they can change in their diet to help them.
Yes, so everybody should eat less saturated fat. So old meat, a biblical reference would be, of course, the prodigal son. The prodigal son came home and the father said, let's get the fatted calf. He didn't say the fatted cow. This younger animal fat is different. So if we would eat more veal, fish, chicken, turkey, lamb.
You know what? That is the first time that revelation has ever come up. Everybody says don't eat, you know, red meat, but you're right. In the Bible, he said kill the fatted calf.
And lamb was used by feasts. So lamb is okay too. That was also, Christ had feasts of lamb.
And Jesus was always giving fish to people. I started thinking about it. He fed his disciples twice with fish, and he broke up the fish for the multitude. So he himself was always feeding people with fish.
And the other
so we definitely have to eat fish.
And the other big example is wine. Wine has...
He was feeding you.
Well, the point is his first miracle was wine, and wine has grapeseed extract in it. So,
antioxidants.
So the powerful antioxidant, 40 times that of vitamin E, is in the...
So are we saying Jesus says it's okay to eat fish and drink wine every night?
In moderation, of course. In moderation.
Okay.
That's the key, in moderation. And that's true of all biblical
and by the way, neither of us drink at all. I know you mentioned
I'll have a glass of wine maybe every 2 weeks.
I can't ever tell you if I've ever even had a glass of
wine?
A full glass of wine. I've sipped one, and, you know, I don't like the taste. I don't know how people drink wine and alcohol.
But getting back to dietary things, obviously more fish. If they're low thyroid, that's very important because thyroid does thin the blood. It also lowers cholesterol.
Okay, so if you have low thyroid, you want to do what?
You want to take thyroid because it does lower the cholesterol and it does thin excess clotting.
And you like Armour natural thyroid?
I like Armour, which every doctor can prescribe. Unfortunately, most doctors will try to put you on the synthetic thyroid, and we would rather them use the natural.
And you know it's a sin to use synthetic.
Sin to use synthetic.
It's a sin to use synthetic.
We have a very big competition as we're seeing. If anybody watches some television, you'll see arthritic formulas and formulas for hot flashes, and there's a big competition going on now between the establishment, mostly synthetic, and the natural people, of course, who are presenting herbs and vitamins and supplements as you do.
But they're coming around. You know, you have to say, when I started this 10 years ago, getting into natural hormones, believe me, I had people, my colleagues, who would come up to me and go, Helen, don't do it. They're going to think you're a quack. And I went, wait a minute. I'm making a choice here between saying to my patient, I'm not going to give you cancer.
Right.
I'm going to give you something that will help you and won't hurt you. And you're telling me that people are, to worry about my colleagues who might think I'm a quack? I'm sorry. I'm going to go for the health of my patient. And of course now, 10 years later, they're all going, I get letters every day now. I have to say this because I took a lot of flack for many years. I get a letter every day, faxed or written, from a doctor who says, I'm interested in natural hormones. Can you tell me about it and help me? Exactly. And before they were going, what are you doing? You're crazy. And
in the last year, I've been asked to speak at 3 different hospitals, which never happened before. A local hospital. I just got asked to talk about breast cancer at a local hospital, which is very unusual. And because of, like you said, they're opening up. Of course, I think the media thing helped. The fact that there's CBS, NBC, and ABC, that's all there was. Now there's so many magazines and so many channels. This has helped us tremendously. Yeah. So there's so much more competition out there media-wise.
Yeah.
So they don't have this closed shop system anymore.
Good for us.
Yes.
I'm getting militant in my old age. I used to be a nice, quiet, never
well, we're talking about $102 billion still being spent in America per year for prescriptions.
Yeah.
So we're certainly not...
And some of them are wonderful.
Yeah.
You know, we're not saying here that every single thing that traditional medicine does is bad. We're just saying there's certain areas that we, who were the doctors in the trenches, who were writing the prescriptions and actually giving them to the patients and watching our patients have side effects and all of these things and going, wait a minute, what am I doing? And then taking the stand to say, no, I'm not going to do this anymore.
And I want to make a point. We all still use prescription drugs. I use prescription prednisone.
Antibiotics, I'm sure you use.
I prescribed antibiotics just recently. So we all do it. What we're saying is God and nature first, and man and synthetics are drugs last.
Right.
So we try to use the kinder, gentler approach first.
Right.
And if we can't get a good enough result fast enough, then we'll go to using the drugs and so forth.
Now, I'm still not clear. If I want to thin my blood and get rid of those clots, what could I, Helen, do every day of my life that's going to be natural?
I'd say, again, my pick is I use a combination of fish oil and garlic.
Fish oils, you like the omega-3, 6s, and 9s, for sure.
And I'll take 3 to 5 a day of those.
Okay, 3 to 5?
Uh-huh.
And
yeah,
that's a lot.
They're big.
They're big.
And I will take a lot of potassium magnesium citrate. This potassium has an effect on lowering blood pressure. Magnesium has definitely been proven to thin blood. So you take a potassium magnesium combination.
Okay.
It's well known magnesium is low in the ground, and the cattle in the Midwest used to get what's called grass tetany. And they used to shake and die after eating the grain or all the grass, and they call it grass tetany. And what it is magnesium deficiency. So the country is very magnesium deficient. And in the 60s, articles from Lancet showed that heart attack victims were very magnesium deficient. So it's been known for over 30 years that heart attack people are prone.
A lot of people take CalMag.
That's very good.
So that's good.
I take it too, but I only take it at bedtime. Otherwise, it makes me sleepy. So I'll just take 3 at bedtime.
Okay.
Calcium, magnesium, citrate.
Okay.
The reason for the citrate studies show better absorption.
Okay. What else can I do?
Well, of course, exercise is good.
The E word.
Exercise is good.
You know what I did yesterday? I went to one of those batting cages and I batted, you know, like the little leaguers do.
My caveat on exercise is simple.
Right.
Do something you like.
Yeah, I like it. So that's what I'm
like
saying.
to play tennis.
I did exercise.
If you told me to walk around or run around a block, I couldn't do it.
Yeah.
But other people who like to run, that's great. I like to play tennis. So the answer is to find something you like
to do, yeah.
If you like, therefore it's not stress. See, therefore you're not causing clots.
Yeah.
So if you like it, you're not clotting. That's the key.
All right, and what else? I got my fish oils, I got my potassium, I got my magnesium.
Well, if you like herbs.
Exercise.
And I know a lot of people out there do. One of the most potent, my brother likes this one, is cayenne pepper. Well, he says after a week of not eating cayenne pepper, he doesn't feel right.
Really?
So he uses it on his food. And he's always, ever since a child, he's loved hot pepper. So,
and that thins the blood.
It's potent, beautiful. It's probably as powerful as fish oils.
Oh.
It must have a biblical reference.
You know,
I haven't checked it out.
They have a drink that you could drink every morning that's 1 lemon squeezed with maple syrup and cayenne pepper. And you make it warm in the microwave and you drink that.
Wow.
And that is supposed to clean your blood out. But I didn't realize it's actually cleaning the
very potent blood thinner.
It tastes good, too. It's good.
I don't know, this is funny because I haven't figured this out. Cayenne pepper, this is the paradox of miracles, because what it does otherwise, it stops bleeding.
Only God knows what he made.
It's used for ulcers. And I think this is true of bioflavonoids. Bioflavonoids also are used to stop bleeding, and they also are used against clots.
Okay. Dr. Privatera, as always, we learned something. He gave us the revelation of the fatted calf, eat veal. And remember, for the recipe for that drink, for that morning drink, write to me here at Doctor to Doctor, P.O. Box A, Santa Ana, California, 92711, and write for show notes. It will be in there. And just a real quick note with a self-addressed stamped envelope, and we'll mail the show notes on to you, and I hope it'll be a blessing for you.
The material presented in Doctor to Doctor is intended solely to educate our viewers and is not applicable to any set of symptoms or personal state of health. Do not attempt to apply this information when treating yourself. If you are having a physical problem, please consult your physician in addition to praying to the great physician. TBN cannot be responsible for the accuracy of medical opinions expressed on this program.
Hi, I'm Dr. Helen Pensanti. I've written a pamphlet called Natural Hormones Made Easy. Plus, I've listed all the great vitamins, minerals, and herbs that you should be taking. Please write to me at P.O. Box 7530, Newport Beach, California, 92660. Or you can write to me here at TBN.